Good morning, everybody. I hope all of you are hale and hearty. In these difficult times, one needs to take care of his health, and we hope that better times will come in the better times will come in the days and months to come. And I wish all of you should be taking care of health in view of this COVID disease and pandemic. Taking care of all the precautions, at least having a mask and maintaining social distancing, and using a sanitizer wherever you come. I hope to see you in the college as soon as possible when the conditions are favorable. Today I'm going to start about a new topic, that is oral diseases in non-communicable diseases. It is not given in the index page of the in the textbook of past textbook of community medicine. But if you look into the book itself, it is marked in page number 434. Please see that. So today I'm going to discuss about oral diseases. Oral diseases are the most common non-communicable diseases, and they affect people throughout the lifetime, causing pain, discomfort, disfigurement, and even death. So they are the most common non-communicable diseases. Oral health is said to be the key indicator of overall health, well-being, and quality of life. So oral health is a very good indicator. So many a times when we do a general examination, we should also note that we should also include a condition called condition of the mouth, teeth, and gums. Many a times students do skip this important finding. So oral health is very, very important. So when you do a general examination, make sure that along with anemia, jaundice, clubbing, and other signs and symptoms what you observe, other vitals, signs and symptoms you observe, you also include condition of the mouth, teeth, and gums. WHO definition has given of oral health. WHO has given a wonderful definition of oral health. WHO defines oral health as a state of being free from chronic mouth and facial pain. So there should not be any pain in the mouth and face. So oral health, it means you should be free from mouth and facial pain. Oral and throat cancer, oral infections and sores, periodontal disease, that is a gum disease, any infection or disease affecting the gums, tooth decay, tooth loss, and other diseases and disorders that limit an individual's capacity in biting, chewing, smiling, speaking, and psychological well-being. So these conditions, if a person is free from all this, what are the conditions I mentioned now? There are 6 conditions that I mentioned over here, and they often limit a person in biting, chewing, especially biting of food or chewing of food, smiling when you smile, speaking, and psychological well-being. If somebody is having a pain in the mouth, you find him to be more irritable. You find him to be sometimes depressed. You find to be being in considerable pain. So many times we have observed our friends also, whenever they have any sort of a problem with concern with the tooth, it often disrupts the psyche of the person, and also even the day or days when a person is suffering from such type of tooth infection or diseases. Now, what is the extent of this particular problem in the world? If you see in the world, there are 7 oral diseases and conditions which account most of the oral disease burden. They are dental caries, number 1. Dental caries also means tooth decay. Periodontal diseases or gum diseases, oral cancers, oral manifestations of HIV, especially thrush or candidiasis, oro-dental trauma, cleft lip and palate, and noma. So 7 oral diseases, they form and conditions form the crux or the main, the main part of the oral disease burden or the quantum of oral diseases in our country. So again, I repeat, there are dental caries, tooth decay, periodontal diseases, that is gum diseases, oral cancers, oral manifestations of HIV, oro-dental trauma, cleft lip and palate, and noma. Almost all diseases are preventable or treatable in the early stages. So if a stitch in time saves life, we all of us do understand. So many of these diseases, if they are tackled in the initial conditions or initially, if you take care, then most of the diseases are largely preventable or can be treated. In the year 2016, we have a statistic about the extent of the oral disease. Oral disease affected around 3.58 billion worldwide, with caries on the permanent teeth being the most prevalent of all the conditions assessed. So 2016, we have 3.58 billion people. Globally, it is estimated that 2.4 billion people suffer from caries of the permanent teeth and 486 million suffer from caries of the primary teeth. So 2.4 billion people suffer from caries of the permanent teeth and 486 million people. Look at the quantum of the morbidity load or the quantum of the disease load from caries of the primary teeth. So children suffering mostly from the caries of the primary teeth. In most middle-income countries and low-income countries, with increasing urbanization and changing living conditions, the prevalence of oral disease continues to increase, and notably due to inadequate exposure to fluorides and poor access to primary healthcare services and heavy marketing of sugars. You've seen heavy marketing of sugars generally you see in fruit juices, especially if you say about Amras or Fruity or Maza, if you find there's a heavy concentration of sugar in these fruit juices, and this is again very much detrimental to health. So heavy marketing of sugars, tobacco and alcohol leads to a growing consumption of unhealthy products. So the prevalence of oral disease continues to increase because of inadequate exposure to fluoride. Many a times there is a deficiency of fluoride in the water that is being used or in the water we consume. And many a times dental services are not there in places in and around the country. So when there are poor access to dental health services, then we have this problem of oral health. And besides this, the sale of what you call products which are rich in sugars, or sale of tobacco and alcohol continues to be leads to growing consumption of healthy products. In India, we have two large-scale oral health surveys which have been conducted. They are the National Oral Health Survey and Fluoride Mapping by Dental Council of India in 2003. So this is a very important oral health survey. National Oral Health Survey and Fluoride Mapping. Next is Oral Health in India. Report of multi-centric oral health survey by Ministry of Health and Family Welfare in collaboration with Dental Department of AIIMS in 2007. So after a gap of 4 years, again, there was another survey, that is report of multi-centric oral health survey. The burden of diseases which are shown in the table in the adjacent slide are dental caries 40 to 45%. So we find what do you find? Dental caries being the most important disorder, followed by periodontal disease, which form more than 90%, malocclusion 30% of children, cleft lip and palate 1.7 per 1,000 live births, oral cancer 12.6 per lakh population, oral submucous fibrosis 4 per 1,000 adults in rural India, dental fluorosis endemic in 230 districts of 19 states. Edentulousness means loss of teeth. 19 to 32% of elderly population, more than 65 years, especially the geriatric population, old people. Oral lesions like thrush and candidiasis or candidiasis due to HIV and AIDS, which constitute around 72% of HIV/AIDS patients. Birth defects involving oro-pharyngeal complex, cleft lip or cleft palate, which involve, they may be 0.82 to 3.36 per 1,000 live births, and others are traumatic injuries like mucosal lesions associated with radiation and chemotherapy, morbidity and deformity following oral cancer surgery. Taking into account the oral health condition in the country, the Government of India has initiated a national oral health program during the year 2014 and 15. So we have also a national oral health program in line with other programs what we have for different communicable and non-communicable diseases. And this is to provide integrated and comprehensive oral health care in the existing healthcare facilities. So, National Oral Health Program deals with provision of comprehensive healthcare services in the existing healthcare facilities like PSCs, CSCs, and district hospitals. Risk factors. Most oral disease and conditions share modifiable risk factors common to 4 non-communicable diseases. Like it can be tobacco use, like consumption of tobacco, consumption of alcohol, and unhealthy diets rich in free sugars. And this leads to the common to the 4 leading diseases. These are common to the 4 common leading diseases of non-communicable diseases like cardiovascular disease, cancer, chronic respiratory disease, and diabetes. It is reported that diabetes is linked in a reciprocal way with the development and progression of periodontitis. So, increase in diabetes results in what you call it decrease of periodontitis, and there is a causal link between high sugar consumption and diabetes, obesity, and dental caries. High sugar consumption, most of them they are seen in consumption of refined foods, either in the form of sweets or foods which are rich in maida, which often have high composition of sugar when they make items for like sweets and other things. So these contribute what you call high sugar consumption, association of high sugar consumption and diabetes, obesity, and dental caries. What are oral health inequalities? Are inequalities of oral health among different sections of the people or different sections of the community or different sections of the country. Oral health inequalities are caused by a broad range of interacting biological, socio-behavioral, psychosocial, societal, and political factors that create the conditions where people are born, people grow, live, work, and age, the so-called social determinants. So what are the conditions they create? That create what you call the so-called conditions, like where people are born, they live, they grow, they live, work, and age, which are often called the social determinants. Social determinants are mostly these. So the oral diseases disproportionately affect the poor and the socially disadvantaged members of the society. So poor and the socially disadvantaged members of the society are often affected because of this oral diseases. There is a very strong and consistent association between socioeconomic status and the prevalence and severity of oral disease. Socioeconomic status, we understand, as we understand, is income, occupation, and education. So there is a strong association with socioeconomic status and the prevalence of severity of oral diseases. So, so higher the socioeconomic condition, and lower what you see the prevalence rate of oral diseases. The association exists across the life course from early childhood to older age and across populations in high-income countries, middle-income countries, and low-income countries. Oral health inequalities are often considered as differences in oral health that are avoidable and deemed both unfair and unjust in modern society. Oral health system and oral health services constitute use of oral health services, and their outcome is oral health status, general health, and the quality of life. So oral health system and oral health services, socioeconomic, cultural risk factors, environmental risk factors are the determinants of the what you call the oral diseases, and these determinants, in fact, also influence oral health services, and also the risk behavior like oral hygiene, diet, tobacco, and alcohol, and which again control the oral health status, general health, and the quality of life. Now, oral health disease and the impact, what we have. So, what is the oral health? In all stages of life, what we observe that oral health diseases like harmful lifestyles, malnutrition leading to tooth extractions, oral diseases, dehydration, malnutrition, tooth decay, all these have what you call an effect on the health and the health of the people, on the life of the people. And oral health promotion by having improved exposures to fluorides through fluoridated toothpastes, promoting regular dental care, supervised toothbrushing, help in reducing oral health inequalities like health, public policies, supportive environments, action on social determinants, promoting oral health and vulnerable groups. So this is all, in fact, how oral health and disease and how oral health promotion can actually affect the life of the people in all stages of life. Starting with pregnancy, newborn, toddler, adolescent, adult, working woman, and old people. Working person and old people later. Oral disease, number one is dental caries, that is tooth decay. Most often the microbial film on the tooth surface converts microbial film, that is a plaque on the tooth surface, converts the free sugars contained in the food and drinks into acids. And this dissolves tooth enamel and the dentin over time. So these acids that are produced, they destroy the tooth enamel and they also destroy the dentin within. And this is getting over by a passage of time. And this is, in fact, helped by continued high intake of free sugars, inadequate exposure to fluorides, and without regular removal of plaque results in cavities and pain. So this may result in tooth decay and cavities and immense pain. And this again affects the oral health related quality of life. If this affects your oral health, this prevents you, this affects your quality of life, this affects your work, everything. And in advanced stages, this may lead to tooth loss and systemic infection or infection throughout the body. And the infection of the different systems of the body and infection throughout the body. That's why oral health is very, very important. This is a picture of dental caries, very common we see, especially in children. Periodontal disease or gum disease. Poor oral hygiene and tobacco use, mainly in people who don't brush their teeth and don't maintain proper hygiene, and those who use smokeless tobacco, or those who smoke cigarettes, or those who use the various forms of tobacco. They affect tissues that surround and support the teeth. Usually they affect the what you call the gingiva, the gums that support the teeth, and this leads to bleeding of the teeth, inflammation of the gums, that is gingivitis, pain, and sometimes bad breath. So this results in pain and sometimes bad breath. And this may lead to loss of gum attachment to the tooth and supporting bone. Sometimes this may lead to loss of gum attachment to the tooth and supporting bone. And this causes pockets and loosening of teeth. That is what is meant by periodontitis. So as a result, the gum is detached, or loss of gum from the tooth, and as a result, there are pockets and loosening of the tooth. There is a loosening of the teeth within the what you call sockets of the mouth or the bone supporting the teeth. This is an example of what to say gingivitis and periodontitis. Severe periodontal disease will result in tooth loss, or the 11th most prevalent disease globally in 2016. Next is tooth loss. Major causes are dental caries and periodontal disease, as we have seen earlier and we have discussed earlier. So they are the major causes of tooth loss. So first is dental caries, we have learned periodontal disease, third is tooth loss. Severe tooth loss and edontulism means loss of teeth or absence of teeth are widespread and seen among the older people, especially the people who become old, the geriatric people, they have severe tooth loss. The above both causes were the 10 causes of years lived with disability in some high-income countries due to their aging populations. This is a big picture of, again, tooth loss. Oral cancer. What constitutes exactly the oral cancer? This includes cancers of the lip and all subsides the oral cavity and the oropharynx. So generally when we talk about oral cancer, we think that it is the cancer of the oral cavity. But it includes cancers of the lip and all subsides of the oral cavity and the oropharynx. Age-assisted incidence of oral cancer, that is cancer of the lip and oral cavity, is estimated to be 4 cases per 1 lakh population, that is 0 to 20 per 1 lakh population. More common in men, older people, and very strongly by socioeconomic conditions. So very common in men, especially men who use a lot of tobacco, who use mostly pan, khaini, and other various tobacco laced areca nuts and all that stuff. So when they start using that, it's very common in them, and especially in older people because of change in lifestyle and conditions, and it's also influenced strongly by socioeconomic conditions. In some Asian Pacific countries, the incidence of oral cancer ranks in the top 3 cancers. Tobacco, alcohol, and areca nut use are among the leading causes of oral cancers. So especially in India and other countries like Nepal, Pakistan, so we find that there is increased use of tobacco and areca nut and alcohol because oral cancers. In North America and Europe, high-risk human papillomavirus infections are responsible for the growing percentage of oro-pharyngeal cancers among young people. Because of the behavioral, high-risk behavior, and because of the lifestyle, especially in North America and Europe, we have HPV infection, human papillomavirus infection, the same virus that is responsible for carcinoma of cervix, and also genital warts. We have around 4 viruses which may causing this, and some of the viruses are also responsible for causation of oropharyngeal cancers among young people. So oral cancer, especially tobacco related, very commonly we see news advertisements about how people who take tobacco, consume tobacco, and are affected by oral cancer, and how they have to suffer a painful death, which is very well exhibited regularly by our government of India in its promotional activities against tobacco. The anti-tobacco promotional activities. Oral manifestations of HIV infections. Oral manifestations occur in 30 to 80% of people with HIV, depending upon the availability of standard antiretroviral therapy. Oral manifestations include fungal, bacterial, or viral infections, of which oral candidiasis, as I said, thrush, this is also called thrush, is the most common, the first symptom early in the course of the disease. Oral HIV lesions cause pain, discomfort, dry mouth, eating restrictions, and are a constant source of opportunistic infections. So they are a constant source of OI or opportunistic infections, especially in HIV. This is also known as thrush or oral candidiasis. Early detection of HIV-related oral lesions can be used to diagnose HIV infection, monitor the disease progression, predict immune status, and results in timely therapeutic intervention. So HIV lesions can be used, if at all you find an HIV-related oral lesion, they can be used to diagnose HIV infection. We have to find about the progression of the disease, and also predict immune status and results in a timely therapeutic intervention. The treatment and management of oral HIV lesions can be constantly improve oral health, quality of life, and well-being. Oro-dental trauma. It is an impact injury to the teeth and other hard or soft tissues within and around the mouth or oral cavity. It can be due to either violence, it can be due to accidents, it can be due to various other causes. World prevalence of traumatic dental injuries in either dentition, primary or prevalent, is around 20%. Now the causes, and what are the various causes of oro-dental trauma? Oral factors, example, increased overjet. So subjecting the teeth to increase flow of water, especially during the treatment of oral conditions when you go to a dentist. Environmental factors like unsafe playgrounds when there are no sufficient guards, or fall from a particular gaming device, or fall from a certain height, like unsafe, especially in playgrounds and in schools, very, very common. We have accidents among the children. Risk-taking behavior, especially without the use of a helmet, or having road rage or racing, where you don't have enough protective equipment to protect your face, or mouth, and head. So risk-taking behavior, over-speeding, these all result in trauma. And also violence, sometimes violence, attack by poor people on the face, anywhere, using weapons, or using various types of devices. So this may cause violences, or this may cause violence among, this may result in violence, and this may again affect the conditions of the mouth. Treatment is costly and lengthy, and sometimes even leads to tooth loss, resulting in complications for facial and psychological development and quality of life. So treatment is costly and lengthy, and sometimes lead to tooth loss. There will be loss of teeth. Noma. It is a necrotizing disease that affects children between 2 to 6 years suffering from malnutrition. So primarily It is seen in children suffering from malnutrition and is affected by infectious disease living in extreme poverty and weakened immune systems. So conditions are usually children suffering from malnutrition and those who are affected by infectious diseases and those who live in squalid conditions, extreme poverty, and those who are having an immune system which is very weak or very deficient. Most prevalent is seen in sub-Saharan Africa, but rare cases are reported in Latin America and Asia. So sub-Saharan Africa and Latin America and Asia are also responsible for this particular condition. So where we see these conditions like malnutrition and poverty in sub-Saharan Africa and also in Latin America and Asia. So very common in these areas. Soft tissue lesion of the gums inside the mouth. What happens exactly? There's a soft tissue lesion or sore of the gums inside the mouth, and this leads to ulcerative necrotizing gingivitis. This may affect the gums and will lead to an ulcer of the gums, and this ulcer begins to necrotize, and this progressively spreads to destroy the soft tissue in and around the gums and also the hard tissues and skin of the face. As a result, we have the condition called NOMA, what is seen over here. This NOMA, WHO estimated that there were around 140,000 cases of new cases of NOMA annually. This was seen way back in 1998. And how to prevent and how to treat this condition of NOMA. Without treatment, NOMA is fatal in 90% of the cases, and when detected at an early stage, its progression can be rapidly halted through basic hygiene, antibiotics, and nutritional rehabilitation. Such early detection helps to prevent suffering, disability, and death. So we have something called suffering, disability, and death. Survivors suffer from severe facial disfigurement, have difficulty in speaking and eating, face social stigma, and require complex surgery and rehabilitation. So what happens generally is there is a huge ulcer on the face, and this causes facial disfigurement and social stigma. And many people have very difficulty in speaking and eating, and this exposes most of the facial tissues, and they require very complex surgery and rehabilitation. It is something which is very, very important in this case. Next is cleft lip and palate. Both are heterologous disorders that affect the lips in the oral cavity, and they either occur alone, that is 70%, or as a part of a syndrome affecting more than 1 in 1,000 newborns worldwide. So what are the causes? They are genetic predisposition, poor nutrition, tobacco consumption, alcohol, and obesity during pregnancy play a role. So tobacco consumption, alcohol, and obesity during pregnancy play a role. In low-income settings, there is a high mortality in the neonatal period. Both if properly treated by surgery, complete rehabilitation is possible. So surgery is the answer, or the treatment of choice, and if done by proper surgery, complete rehabilitation or the condition is possible. This is the cleft palate, this is the cleft lip and the palate. Very often seen in children. Prevention of oral diseases done by public health interventions by addressing common risk factors such as promoting a well-balanced diet. A diet which is low in sugars, because these sugars may again damage or cause diseases like caries, periodontitis, and other things. So promoting a well-balanced diet which is low in sugars and avoiding high sugary food. And promoting a diet which is rich in fruits and vegetables. So this may also prevent what you call most of the oral diseases like caries, periodontitis, and oral cancer. Reducing smoking, the use of smokeless tobacco, including chewing of areca nuts and alcohol consumption. This may reduce oral carcinoma. So very important, especially tobacco chewing and alcohol consumption, which may promote oral carcinoma. And so we need to reduce the consumption of tobacco and chewing and alcohol consumption. Encouraging use of protective equipment in fruits and while traveling in motor vehicles, especially helmets, full face helmet covering the head as well as the face is very, very important to avoid injuries to the face or facial injuries or any injuries to the jaw or maxilla or upper part of the mouth or any part of the face. Very, very important, especially protective equipment sports and while in traveling motor vehicles, which of course has been made mandatory and sometimes man-made is made mandatory and sometimes penalized if somebody is not wearing such protective equipment. Girish. Photo. Dental caries can largely be prevented by maintaining a constant flow of fluoride in the oral cavity. So fluoride maintenance is very, very important, especially in the oral cavity. Optimum fluoride can be obtained such as fluoridated drinking water, salt, milk, and toothpaste. I mean, they can be, all these can be fortified. So water can be fortified, salt can be fortified, milk can be fortified, and toothpaste can be fortified with fluoride, especially in areas where the fluoride content is less. And twice brushing with fluoride containing toothpaste, 1,000 to 1,500 parts per million should be encouraged to prevent dental caries and dental fluorosis. So very, very important. So especially in areas wherever there's low fluoride content, the water bodies and foodstuffs have to be fortified with fluoride. Long-term exposure to an optimal level of fluoride results in substantially lower incidence and prevalence of tooth decay across all ages. Oral health inequalities must be reduced by tackling the broader social determinants through a range of complementary downstream, midstream, and integrated upstream policies such as water fluoridation. Very, very important. Wherever water, the source of water, being the reservoir, the water in the reservoir, or the water in a particular storage place has to be fortified with fluorine so that the water that is supplied through the city or a municipality or a corporation, supplied through them is utilized by the people there and don't suffer from deficiency of fluorine. The regulation of marketing. Marketing is very, very important, especially toothpaste with fluorine content and having fluoride content so as to prevent dental caries. And promotion of sugary foods to children. So many countries have put up a ban of consumption of sugary foods like candies or foods that is rich in sugars and taxes. And many a times more taxes are imposed on sugar sweetened beverages to discourage people or children from having this thing because of the increased cost of this particular drinks. Promoting healthy settings such as healthy workplaces and promoting schools. And so in many countries, what it happens, many countries, they have also banned the use of drinks or the consumption of drinks, especially in canteens, which are rich in sugar, or fruit juices, which are rich in sugar, so that children won't buy. And also in foodstuffs like jams, which are rich in sugar, or candies or chocolates, which are rich in sugar, are avoided. And promoting healthy settings, such as working places, and promoting in schools is very, very important, especially to reduce oral health inequalities and see that people have adequate oral health among them. So this finishes the entire chapter on oral diseases, and please read them. As I said earlier, it is in page number 434 in the textbook of Preventive and Social Medicine by Park. So please do see that. This is one of the chapter that is missed in the index. Thank you for your patience. Thank you.